Health Minister Doctor Aaron Motsoaledi has warned the delegates attending the G20 health ministers meeting in Polokwane against a pervasive threat of financialisation of health.
He says he's concerned that healthcare is turned into a marketable commodity that is available to a select few.
Addressing health ministers and senior officials from the world's leading economies, Motsoaledi said they need to take lessons from global experiences to ensure public financing remains central.
I really want to emphasize that we must also be vigilant against the pervasive threat of financialisation of health, whereby healthcare becomes a marketable commodity that is available to only those who have, but not to the rest of us. We need robust regulatory guardrails, learning from global examples, to ensure public financing remains central. Health cannot just be a question of who has got more money. It's a fundamental human right. We must defend it from forces that prioritize financial returns and profits over human dignity and survival. Our universal health coverage aspirations are nothing without the hands and minds that deliver care. The global shortage of health care workers is a global emergency. We must treat this workforce as a critical economic asset through, number one, cross-sectoral stewardship. Health, finance, and labor ministries must collaborate to set a binding G20 standard for decent work and equity, including mandatory steps to achieve equal pay and eradicate workplace violence by 2028. Two, on ethical migration and co-investment, we must establish a voluntary co-investment mechanism to ethically support source countries, balancing global recruitment with substantial funding for training, retention, and empowerment of community health workers. Our actions here must reflect the principle that we are all equally deserving of care and opportunity. The lessons of the last pandemic compelled us to build resilience now. Our immediate diplomatic task is to ensure the swift, equitable conclusion and operationalization of the pandemic agreement and the amended international health regulations. The world can no longer tolerate vaccine nationalism that sent others to the grave earlier than they should. The pathogen access and benefit sharing system, PEPS, ANEX, is central to this fight for equity.